Hi, I'm Martha Murray, and I'm one of the orthopedic surgeons here at Children's Hospital Boston. This is Elizabeth Beck, one of our physician's assistants, and we're going to go through with you today how to adjust your post-operative brace. The brace we're going to show you today is made by Breg. It's called the T-scope brace. It has 2 hinges, one on either side, and it's held together with 4 straps. We're going to show you a little bit about how to put it together. Most of this work we will have done for you in the operating room, so you'll wake up with the brace adjusted, but sometimes when you get home, you'll need to do some of these adjustments as well. We'll show you those specific adjustments you'll likely need to do at home. But what we do in the operating room while you're still asleep is we're going to adjust first the hinges to the right length. For most people, it means setting the bar at about the number 1, and then we can clip down these clips to make sure that it's secure in place. If you find that your brace is sliding like this, up and down, check to see if the clip has come unhooked. So you can just click it down like that and secure it again in place. And again, we are going to do all 4 of these at the number 1 position. So let's do the other side too. This makes sure that the 2 hinges are the same length and the length that you need for your surgery protection. The next thing we're going to do is we're going to set the range of motion of the brace. So the brace as it comes can have a very wide range of motion. For most of our patients, initially we're going to limit your motion to about 90 degrees of bending or flexion. So in order to do that, we're going to take these little triangular tabs and pull it out to release it, and then we can slide it over to the number 90 and stick it right back in at the number 90. And that lets us then adjust the brace, so now it can only go from 0 to 90 degrees. Can't go all the way, so that helps to protect your knee. The other thing you're going to be asked to do is to lock your brace at times. So this device here is what locks the brace. Right now the brace is unlocked, but if I slide that down, now the brace is locked, it can't move. We'll often ask you to lock it at 0 degrees for sleeping at night for the first several weeks after surgery. You can see here how the number 0 is lined up with the line on the brace. That means it's locked at 0 degrees. If you're locking the brace, you want to lock it on both hinges. So we're going to lock this one as well. So now it's locked. Now I'm going to fit the brace on Elizabeth's leg. So we're going to unlock it to do that. So we've got to unlock both hinges so that now the brace can move. Did we set this one at 90 degrees? Let's set this one at 90 degrees as well so the 2 hinges match. So we're just pulling that out. We're going to put that in there so we've got that hinged. Now we've got 90 degrees on both hinges. So can you lift your leg up for me? So we're going to put the brace on. We're going to slide it so the 4 straps are under Elizabeth's leg there. And then we're going to ask her, Elizabeth, can you bend your knee up a little bit so that we can make sure the hinges are matching where her knee motion is. Typically that means that the top of the hinge is about at the top of your kneecap, but sometimes it's easiest just to put the brace on with a pillow under your knee so you make sure you get the bend in the right place. Okay, you put your leg down, straight, good. So now you can see that the brace is clearly too big for Elizabeth's leg, so we're going to adjust it to her leg by adjusting the straps. And typically what I'll do is I'll just hook one of these front straps just to kind of hold it in place, maybe 2 of them. But you can, and what I want to do is adjust the hinges so that the hinges are perpendicular to the table but parallel to each other. So you don't want the hinges coming in like this towards each other or around the back of the leg. You want them on the side of the leg and parallel to each other. The other thing that when you fit the brace is that you'll notice that sometimes there'll be space between the hinge and your knee on one side or the other. That's totally normal and fine and not a problem with the brace. The key thing is to make the hinges parallel to each other. So now we've got the brace just kind of provisionally on, and we've got the hinges where we want them. But if Elizabeth lifts up her leg, do you mind lifting it up? You can see how there's a lot of slack here in the straps underneath. So the first thing we're going to do, you can put it down, thank you, is we're going to tighten up those straps underneath. And in order to do that, there are these holders on the side, Velcro holders, and we can flip out these tabs, and the tabs will let us then pull the back through. So why don't you lift up again just for a minute. So now I've released the tab here, and I can pull this through. Do you see how it's tightening up back there? But I want to make sure I don't tighten it up too much. I don't want to bring this hinge around the back. So I just tighten it up. Then I'm going to tighten up the other straps just to get the slack out of them. We'll do the final adjustments later, and so we're going to do that on all 4 of these here. And then I put the tab back to kind of anchor that strap in the back. Okay, you can come on back down. And now what we're going to do is we're going to tighten up in the front. And you can do that simply by releasing the Velcro tab here on the front and then pulling through the hinge like this. And then you can fasten that back on. So we're going to hook this on, take this, and now we can just pull this through the hinge like that, back around on the back. this bothering you anywhere, or is it okay? Now one thing, sometimes on these upper straps or even on the lower straps, you'll find that the Velcro tab is going to hit plastic, and so you can't make it hook, or it's hooking way around the back of your leg and it's inconvenient. These tabs actually can come off the end of the strap, and then you can fold the strap, or if you need to, you can trim it, and then you can put this tab right back on the end of the strap that you folded over, and so that it now attaches to something that's sticky for the Velcro. So that's another trick that you can use to adjust it. So most of this will have been done for you in the operating room at the time of your surgery. The other thing that will happen in the operating room, though, is oftentimes you'll have an ice pack placed underneath your brace. In that case, after a day or two of using that ice pack, you may want to take the ice pack out and get around. When that happens, these straps will often be a little bit loose because they will have been sized to have the ice pack under there. If that's the case, then you're going to want to tighten up particularly these two straps once you take the ice pack out. So in order to do that, the first thing you're going to do is release the two straps, and then you're going to check the back. And so if Elizabeth has, you can see how she has some slack still here in the back because we've taken the ice pack out. So again, same thing that we did earlier, you're going to release this tab right here and then gently pull the strap through in the back so that you get a nice fit there on the back of your calf, and then you can tighten the front down. Same thing here, we're going to release the back tab first, so we can pull that through, anchor that, then we can pull the front tab through. Do you want to just try bending your knee up and making sure it feels like it's hinging in the right place? Does that feel pretty comfortable? Yeah. And that's how you put on the brace and adjust it.